So let's begin with another day of Alan's keynote study streak, and today we'll study four rheumatic remedies, out of which one is kalmia latifolia. Now, when you line up these remedies in a study session, or in your everyday study session, or everyday study routine, you should try to find out the commonality between these remedies. Once you try to find the commonality after you read it, of course, you will be able to be in a much better position to understand and prescribe remedies in such cases. For example, kalmia. The first thing that you read about kalmia is pain, sticking, darting, pressing, shooting in a downward direction. We saw yesterday that Lidum has upward direction of complaints, kalmia has downward direction of complaints. So they will have more or less similar sensations or more or less similar presentation of complaints. Only the direction of complaints will explain you what you need to do for understanding of in prescribing either remedies. If it is downward direction, there is also a medicine which is known as cactus grandiflorus. The key symptom of kalmia latifolia is that the pains are attended with numbness, or there is numbness of the same part where the pains are. And if you are able to pick this up, at times patients don't tell you that these pains have there is numbness with the pains, or pains are attended with numbness. But it is your job, once you try to find out two things which characterize kalmia, try to ask the third thing, and maybe that's what the three-legged stool of prescribing states. So the same thing we also see in the remedies: aconite, chamomilla, platina. Okay. Adapted to acute neuralgia, rheumatism, gouty complaints, especially when the heart is involved as a sequelae of rheumatism or gout. So you will see that patients are in their middle age or late 50s or 60s, and they have reported to you with heart problem, or they have angina pains, or they have IHD, or more of rheumatic heart disease. But if you trace back the history of such patients, you will see that they have had small episodes of joint troubles. It can be gout, it can be rheumatism, way back in their younger age, which was treated with steroids, which was treated with antibiotic medicines, which was treated with whatever local doctors they approached. That is where you established a relation. At times patients do remember, and this past history is the missing link which we need to lay our foundation stone also for prescribing medicines as intercurrent, or maybe to push the case forward. At the time of presentation, patient may share some symptoms which may belong to constitutional remedy, or you seem to think about any constitutional or a deeper acting antisodic medicine. But you will need these medicines, which are smaller medicines, which will kind of go to the root of the disease from where the problem started, and help cure such cases. So that is about kalmia from Allen's keynotes. Patient will present to you with some heart complaints, but you go back in the history and you find out that there was rheumatism or gout which was treated with some medicines. In fact, right now with me also, there are 5 to 7 patients who have uric acid deposits in their joints, or they have high uric acid. So not taking any medicine for uric acid or for gout, or presenting complaints of gout, does not mean that they don't have gout. Increase of uric acid deposits will also indicate that they have a gouty diathesis, and such cases will mostly straighten out with a dose or two of kalmia as an intercurrent to the constitutional medicine. Or you may need to give kalmia as a routine medicine along with the constitutional every few days, like every 7 days, every 10 days. Then you have vertigo when stooping or looking down, like the remedy spigelia. Eyes are also affected by kalmia, which is having severe stitching pain in the right eye and the orbit. If it is left eye, it is spigelia. If it is right eye, it is kalmia. Okay. Then you have stiffness of the muscles of the eyes and pain when turning the eyes by least movement of the eyes because it causes pains. Also, the other remedy is spigelia. And the pains begin in the sunrise, aggravated at noon, and they leave at sunset, which is very similar to matramine what we see. Then in cardiovascular system we have uh, the symptoms that have heart diseases that have developed from rheumatism or alternate with it. I already shared about it in a few minutes ago. Those who have joined late can go back to the session and watch it. Pulse is slow, scarcely perceptible, 35 to 40 per minute, and there is a pale face and cold extremities. Rheumatism with intense pain changes places suddenly, going from joint to joint. Joint is hot, red, swollen, worst from least movement. In relations, you see kalmia similar to Lidenpal, rhododendron, spigelia in rheumatic affections and gout. Rhododendron and spigelia are the remedies which we will be covering in our session today. Interestingly, kalmia follows well spigelia in all cases of heart disease or where the indications are very much ripe for prescribing kalmia latifolia. So next we go is a very similar remedy which is spigelia, and if you read spigelia, it is one of the good remedies for prescribing in cases of big range of cases, right from children to adulthood to different pathological cases. And if you are a good observer and good prescriber, you will be in a better position to employ these remedies as a guide to cure rather than just stick with your fixed number of remedies like say 10 or 15 or 20 polycrests. The first thing which we read in spigelia is adapted to anemic debilitated subjects of rheumatic diathesis, to scrofulous children. It is adapted to scrofulous children also who are afflicted with ascarides lumbricoids. So the patients who report to you with worms, there are different types of worms, but the indications for all the worms will mostly be same. You will need to prescribe on the basis of constitution. You will need to prescribe on the basis of their physical generals, and if there are any modalities of the complaints. Otherwise, you will need to prescribe only on the basis of constitution. If the constitutional remedy is coming, say calcarea, you can think of cognates of calcarea for prescribing for worm cases. Give in extremely low potency 6 or 30, frequent repetition, that is going to push the worms outside, or it will kind of push towards cure. Then you have pains. Persons in spigelia, they are persons with light hair, pale, thin, bloated, weak, wrinkled, yellow and early skin. They are afraid of sharp and pointed things like pins, needles, etc. Body is painfully sensitive to touch. Parts touched feel chilly. Touch sends shudder through the whole frame. So you saw this also very strongly in all the remedies we covered yesterday, which was the injury remedies, especially the arnica is a remedy, or you can say Lidenpal. It is also there in Kalika, it is also there in spigelia. Then you have stammering. First repeats the first syllable 3 or 4 times and then he gets better. And if it is a case of child who has worms or the mother has been giving some wormy treatment, then you should think of spigelia more often, because it is a different components which you bring together, that is what leads you to prescribe spigelia. So you will see a case of child who is thin, debilitated or looks like anemic, You will have the mother complain that he does not eat good food, he does not eat well, he is not putting on weight. Third thing, the mother is giving him wormy treatments every 3 months, 6 months. You have, and he also kind of fears or stammers a bit in public speaking, or he cannot speak well. Those are the cases where you should think of giving spigelia. Bringing these components together is the key to prescribing spigelia. Then you have head complaints, nervous head complaints, which are nervous headache, which are periodical, begin in the morning at the base of the brain and spread over the whole head, locating in the eye and temple of the left side. If it is right side, it is sanguinaria silica. If it is left side, it is spigelia. And the pains are pulsating, violent and throbbing. Headache begins at sunrise at its height till noon, like we saw exactly in kalmia, and declines till sunset. And we also have the same similar situation with natramur and tabacum. But in tabacum, you will see that there is more of coldness and more of nausea with the headache rather than just the headache which is there. Then you have in Allen's notes for spigelia, prosopalgia, which is of kind of a face pain where the bones of the face are more affected. If you have experienced this complaint yourself, you will know what it means. Like, it is not a kind of a nerve pain, it is not kind of a sinus pain, it is a different kind of a dull pain which is in the facial bones. Rhododendron is one of the top remedies, spigelia is another top remedy. Both have opposite sides. So we see in spigelia there is a mention that there is a left sided periodical prosopalgia which comes at certain seasons, and there is affections of the orbit, eye, malar bone, this is the malar bone, and teeth, and from morning till sunset. The pains are tearing, burning, cheek is dark red during cold and rainy weather, and also aggravation from teeth. The same is the situation also with rhododendron, but I believe it is on the opposite side and has some different modalities. Then you have eye complaints where spigelia works very well, very beautifully. You have intolerable pressive pain in the eyeballs, could not turn the eyes without turning the whole body. Worse, especially making false step. Sensation as if eyes were too large for the orbits. Sensitive to touch, like the remedy semicifuga comocladia. As if a band around the head, like the remedies cactus, carbolic acid, sulfur. Then you have sharp, stabbing, sticking pains through the eyeballs, back into the head from cold, damp, rainy weather. So you see there is a mention of cold, damp, rainy weather the second time. Although if you go in the modalities and see for spigelia, it's not mentioned. But if it is mentioned twice, you should remember that this remedy has aggravation from cold, damp, rainy weather. Next you go further and you see that there is sharp stabbing, sticking pains. We covered this. And also the same is the situation with toothache, which is which is aggravated from smoking tobacco, or even if they get exposed to tobacco fumes, they will get aggravated. Only on lying down, better if they are lying down, and better if they are eating, which is the case also with plantago. Worse from cold air and water, returns from thinking about it. Copious offensive mucus from posterior nares drops into the throat, causing choking at night, like the remedy hydrastis. So if you try to understand the different remedies indicated for anterior part of the ear, nose and throat, and posterior part of the ear, nose and throat, it will make your job easier. Spigelia, natrum phos, hydrastis, Kali bichromicum, all these remedies have action on the posterior part of the throat and the internal part of the nasal cone more than the anterior part. Kali bichromicum is a different remedy, it has action on the front as well as the back. But if in this way you will be able to classify the remedies By seeing a common pattern, you will be in a better position to prescribe whenever those cases with certain pathologies will report to you. So you have posterior nair complaints, and then you have dyspnea, where the patient must lie on the right side or with head high. Similar case we saw in spongia also, and we will see in the remedy cactus. Pains in the chest are stitching needle-like pains, and this is characteristic for spigelia throughout its course of action on different parts, whether it is chest, whether it is eyes, whether it is tooth, anywhere. At times the patient will give you this sensation because this was observed many times by many provers in different scenarios. Cardiovascular system action of spigelia, rheumatic affections of the heart, like the remedies kalmia, lidam, naja. So there are remedies which work more on the vessels of the heart. Okay, they will try to work constitutionally to remove the plaques, to remove the obstruction which is causing the circulation. Those are different class of remedies. These remedies which have been mentioned, for example, if you see kalmia, lidam, and the remedy which we are studying spigelia, these are more involved in anginal pains or radiating pains which begin from the heart. So they will need to be given to those patients as an acute prescription, or as prescription for taking during their pains as an urgent prescription. This is going to simplify your job of uh, avoiding the patient to take allopathy, and the patient will be dependent on your medicines only for the entire course of treatment. He may not need sorbitrate as well. Naja is one of the different remedies over here mentioned, which is actually a snake poison. And if any one of you were part of our kingdom workshop, you will understand that these remedies we discussed have more action on the blood vessels, on the circulation, and they will work like an all-rounder. They will work on the vessels, they will work on the pains, they will work in removing the plaques, etc., etc. So in this way, you need to understand the remedies which you will give to the patients of heart disease as acutes, which are spigelia, kalmia, lidam, or you will give them as a deeper medicine, which can be naja or calcarea, phosphorus, sulfur, sepia. It can be anything. So in spigelia you have rheumatic affections of the heart, systolic blowing at the apex, aneurysm, chest affections with stitching pains synchronous with the pulse. Now this is a bit difficult to elicit because pains go with the pulse, or during the time of pain, if someone is observing the pulse or picking up the pulse, if it is possible, well and good. Otherwise you may probably not get this unless the patient or relative is well versed to understand how this connection happens. But you can see there is aggravation from motion, which can be obtained chest affection from motions, or aggravated from cold or wet weather. This is the third time which we see the mention of cold, wet, rainy weather, and if you understand this commonality, it will make your job easier. Palpitation, violent, visible and audible from the least motion when bending forward, systolic blowing at apex. So bending forward has many complaints for spigelia, whether it is in the eye, in the head, in the chest, in the respiratory, anywhere in the different parts of the body. Gastrointestinal system, we have scirrhus of sigmoid or rectum, atrocious burning, unbearable pain, and the other remedy is alumen. So those cases where malignancy is there or cancerous turn of events have happened, think of spigelia as one of the remedies for the rectum. Yesterday we discussed about ruta and how I gave ruta in those cases of in one of the cases of cancer long back. This is like 15, 12, 13, 14 years ago, and it was just initial days of my practice. So ruta, mother tincture I had given. Spigelia was one remedy in my mind, but she didn't have any indications for prescribing spigelia. If there are stitching pains, you can think of spigelia as a remedy. In such grave cases, you may need to give them a low potency, preferably tincture or 6 or 30 up till 30, and repeat it maybe thrice or 4 times a day, and keep observing. If there is any improvement, maybe reduce the dosage to twice a day or once a day. Then you have gastrointestinal system, worms which are mentioned. There are typical indications. If you see the constitution, you can think about this remedy. Otherwise, if there is other remedy indications, think about those remedies. Aggravation from motion, noise, touch, turning the eyes, which we also saw in kalmia, from every shaking, commotion or concussion. This is the aggravation for spigelia. For amelioration, you see there is line on the right side with head high. Arsenic, cactus, spongia are very close in this modality, and you need to differentiate based upon whatever are the sphere of actions or the nature of complaints. In comparison, you see there is mention of aconite, arsenic, cactus, digitalis, calica, naja, kalmia, spongia in heart affections. So that brings us to the end of the second remedy we covered today, which is spigelia. The first was kalmia. And now we go to two small remedies which are very much important in our practice, and you will need them in the current age where people are using computers and mobiles and all the movable tablets left, right and center. So the first remedy that we come across is ranunculus bulbosus for such cases where you will see that there are typical pains in single spots. But before that, there is a very typical different scenario which we see in Allen's keynotes, which is mentioned as one of the most effective remedies for bad effects of alcoholic beverages, spasmodic hiccough, delirium tremens. Now, if you have experienced or cured or handled hiccough cases, you will know how tough it is. In various books, they have mentioned Nux vomica, Macphos, China as the main remedies for treating hiccoughs. You will need to examine closely about how it started and if there are any concomitant symptoms, because at times there is nothing available in the case, just the hiccough is going on. You will need to give on the basis of his constitution or maybe how his physical generals are at the point of the developing the hiccough. Ranunculus bulbosus is one such remedy which will help if the patient has a habit of taking alcohol. This can be obtained from the relatives or from the patient himself. So Dr. Samuel Kumar, you have suggested very nice remedy, ginseng for hiccough. If you could mention some indications for it, it would be helpful. These smaller remedies can be prescribed, no doubt about it, but they will need key indications which are only present in the cases. Otherwise, you can resort to bigger remedies which are Nux, China or the other remedies. So it's a good suggestion from Dr. Samuel on Instagram for ginseng for cough. So let's go forward and see that there is mention of day blindness and mist before the eyes in ranunculus bulbosus, pressure and smarting in the eyeballs, the remedies being phosphorus. So this is the third remedy. Now you can see that there is a commonality, and the commonality is that we thought that these remedies, from their names and from our record of reading them earlier, they were seen to be more indicated for the joints, for the arthritis and all these complaints, but they all seem to affect the eyes in a linear fashion. And if you are able to see this connection, you will be in a good position to prescribe these remedies in such cases also. So there is day blindness, mist before eyes, pressure and smarting in the eyeballs, like the remedy phosphorus. Then you come to chest pains which are stitching like, sharp shooting, neuralgic, myalgic or rheumatic in the walls of the chest. Costochondritis pains are typical of ranunculus bulbosus. They are going to help cure innumerable cases. Coming in paroxysms, excited or brought on by atmospheric changes, inflammatory, depending upon spinal irritation. Agaricus is one of the remedies also. Intercostal rheumatism, chest is sore and bruised, aggravated from motion, from touch, from turning the body, like the remedy bryonia, aggravated, and also it is aggravated for ranunculus bulbosus in wet and stormy weather, which is also the case with rustox. So all cases of costochondritis or sensitivity of those smaller joints getting affected in stormy and rough weather, damp weather, think of ranunculus bulbosus. Also think of ranunculus bulbosus in cases where they are working constantly on the PC for a long time, unable to move or don't move. In those cases also you will be able to prescribe ranunculus bulbosus with good success. Pleurisy or pneumonia from sudden exposure to cold, like the remedy very strongly we prescribe aconite and arnica, but over here it is from being overheated. Then there are muscular pains about the margins of the shoulder blades in women of sedentary employment, often burning in small spots, like the remedy agaricus and phosphorus, and it is from needlework or from typewriting or piano playing, like the remedy semicifuga. So there will be patients who will report to you that they work for 8-hour shifts in a single position, they can't move because they have targets to be met. In those cases, if they develop chest complaints which have little pains here and there, think of ranunculus bulbosus as top remedy. You will need to choose the remedy based upon the location also. For example, yesterday I had a case where she was complaining that there is pain in the coccyx. Coccyx has a very strong nerve area, and you need to find out remedies which work on those nerve areas. I gave her Kali bichromicum 3-4 days back, but she didn't improve. So yesterday I changed the medicine and I gave something else which works on that area, preferably it was more or localized on that action on that area, and the remedy was hypericum. So in this way, if you try to narrow down few things, you will be able to prescribe from the indications of the location as well. In ranunculus, we also see that they have corns, they are sensitive to touch, smart and burn, like the remedy salicylic acid. It is also a good remedy for herpes, shingles which are preceded or followed by intercostal neuralgia, like the remedy mesothelium. Vesicles may have a bluish appearance. So all those cases where along the line of the nerves, if there is affection and there has been destruction of the skin mucosa superficially, and you can see that it's going in a linear fashion along the nerve course, think of ranunculus bulbosus as first remedy. If it is in other locations, then you can think of remedies like hepar, mesothelium or merxol for those cases. If the vesicles have developed too faster, then you can think of rus venenata, or you can also think of entim-tart as one of the remedies. But entim-tart will have more of backache, which is a concomitant present in written in many books. Next we go to the relations of ranunculus bulbosus, and if we see in relations, they have mentioned, Ellen has mentioned aconite, arnica, bryonia, clematis, euphorbia and mesothelium. So you see these 3-4 remedies which have more action on the joints, and the next 3 remedies which have more action on the skin. In this way you will be able to understand that you need to prescribe this remedy in such cases where it is more affinity for the joints and also on the skin. Incompatible with sulfur and staphysagria, aggravation from contact, from motion, atmospheric changes, especially wet and stormy weather aggravates ranunculus bulbosus conditions, like the remedy rustox. So this brings us to the end of third remedy. We discussed ranunculus bulbosus just now, and now we go to the last remedy, which is a very small remedy but very important. If you are staying in a place which has sudden changes of weather, like there is sudden atmospheric changes, like the north parts of India or European countries, where suddenly it changes from cold to extreme cold or wet weather to cold. So you see the mention of rhododendron in Allen's keynotes. We see the first line which is mentioned: nervous persons who dread a storm and are particularly afraid of thunder, aggravated before the storm, especially an electrical storm. Similar presentation we see in natrum carp, phosphorus, sorinum, silica. Cannot get asleep or remain asleep unless the legs are crossed. Now this is a very vague indication, but if you get it, you will be able to prescribe. Toothache in every spring and fall during sharp east winds, worse from change of weather, thunderstorm and windy weather. Now next comes a very great explanation about this remedy, and if you are able to pick it up in your cases, you will be able to cure many cases of testicle affections. Induration and swelling of testicle after gonorrhea or rheumatic affections or exposure, like the remedy clematis, orchitis and sensation in the gland as if it was being crushed. Now getting this sensation again is very difficult, but you will probably get just a dull kind of pain in the orchitis cases, or in cases where there is swelling of the testicle or there is induration, and you will be able to come to rhododendron or a group of other remedies. Pulsatilla is also one of the top remedies you can think in such cases. Allen mentions aurum and chamomilla for those cases of testicles which have sensation of being crushed. Next you have is extremities which have acute inflammatory swelling of the joints, wandering from one joint to the other, severe pains at night, aggravated in rest and during stormy and rough weather, like the remedy kalmia. I would say it's also close to calcarea fos, it's also close to rustox. Rheumatic drawing tearing pains in all the limbs, worse at rest and in wet, cold, windy weather, rustox is mentioned. Gout with fibrous deposits in the great toe joint, rheumatic and often mistaken for bunion, colchicum and lidum. So if you have treated cases of uric acid deposits in the joints, or you may treat cases of uric acid deposits, you will understand that even though the uric acid levels are normal, the joint is affected. So in those cases you need to give rhododendron, because it's more of a fibrous tissue which is affected rather than biochemical affection of deposition of uric acid, where you need to prescribe benzoic acid and lidampal rather than rhododendron. The other remedies mentioned in brackets are colchicum and lidampal. So next we come to modalities of rhododendron: aggravation and amelioration, stormy windy weather, electrical changes in the atmosphere, on approach of thunderstorms, symptoms reappear with rough weather. So every few days, if the weather changes, the patients get affected, rhododendron can be indicated. It can give a push towards the positive direction. Amelioration from wrapping up the head warmly, dry heat and exercise. You can compare or see rhododendron, which is very similar to bryonia, conium, calcarea carp, lidum, lycos, sepia and rustox. So it brings us to the end of fourth remedy today. We discussed kalmia, we discussed pygelia, ranunculus bulbosus and rhododendron. So that's all from today's session on Allen's keynote study streak. It's been almost 35-36 days since we have taken up this, and we probably would complete it in this month or maybe early part of next month. Anyone having any questions on Instagram or YouTube, please feel free to type so we can call it a day. Alright, so I guess someone is typing or not, I don't know. Okay, Dr. Shraddha Kudalkar, thank you. So, thank you for joining, and you can stay connected for some interesting things that are coming up soon. If you are a part of learning and if you are a part of being passionate for homeopathy, you will find ways to help you progress faster. Otherwise, you will probably be stuck up in the same place for years, and there won't be a push or someone who will push you. So you are the one who should be pushing yourself every day, and if you are dedicated, you will probably be growing yourself much faster. So I think thank you for your wishes, Dr. Priyanka and Shirley, and we'll call it a day. So we join tomorrow again 5 p.m. with some new group of remedies which are remaining from Alan's keynotes. There are around 100 odd or 100 more than 100 remedies which we have covered so far, and we'll cover the other remaining remedies as well soon. So thank you for joining everyone, and thank you Dr. Jay for your wishes as well.